A lot of times, again, this gets at the technical component of the role sometimes, but we have this tendency of just getting super complex into what we build and what we're trying to solve for, when in the end some of that stuff doesn't matter. When you're a healthcare data scientist and you're building tools and applications to get patients better, the outcome that matters is, are people getting better, right? So being able to tangibly assess that and really show the value that you're bringing, I think is really really important. I don't think just for someone who's 3 or 6 months in. I'm 8 years in, and that is something I'm still continually doing.
Welcome to the Health Science Coach Podcast. My name is Drew Garner, and I'm a health science and physical education teacher. This is a podcast to help students, parents, and recent graduates learn about pathways into healthcare and sports medicine careers. These industry professionals lay out how their experiences have helped them get to where they are now. If you enjoy this content, please subscribe to the channel or download through your podcast player. Thanks again for spending some time with us today. Now let's dig in. Today we get the pleasure of meeting with Mark Burghart, PhD. He is the Director of Data Science at Wellsky in Overland Park, Kansas. As a data scientist and clinician, he is able to create tools to help care providers deliver the best possible care to the people they serve. Mark, welcome, and thanks for joining us today.
You bet. Yeah, happy to chat with you.
So, as a data scientist, can you give us a little detail about your career and what you do as a data scientist?
Yeah. So as a data scientist, like I think the simplest definition that I typically give people is, myself and the people I have a chance to work with on a day-to-day basis. We just try to take information, whether that's information about a patient, information about just broad healthcare things, and we try to allow providers to make better clinical decisions for the people that they serve. And so a lot of times that's building like predictive models. I'm sure like in the real world today we hear about like artificial intelligence and machine learning. That is the type of stuff that we do as data scientists, are building tools, making use of that. But in the end, we just try to build, things that allow people to make better decisions given what they know today. So
Okay.
that's most of my time.
All right. So, a typical day in the life or week in the life of with some of your duties and experience and some examples of how that you're able to provide that to your providers.
Yeah, a lot of my time is spent actually talking to people caring for their patients out in the real world, and that's really important for us to have context for like what problems exist in healthcare today, and more, I would say more importantly, is machine learning or a data science model part of the solution to fixing the issue or the problem. And so we do spend quite a bit of our time talking with clients, talking with patients, talking with healthcare providers, better understanding like the challenges they are facing on a day-to-day basis.
Right.
We also spend obviously a ton of our time like analyzing data. And that can include information from like health records. So if you're going to the hospital, all that information they collect about you is recorded in an electronic document that we will analyze over millions of people. But that can also include things like your smartwatch. That can include things like your cell phone accelerometer, so we can track how much movement you have and how you're sleeping, and things like that, to ultimately create like more holistic view of you as a person and the challenges that you may or may not be facing. And from there we work with software engineers, and again just continuing to work with healthcare providers to make sure that we're building tools that allow them to do their job more effectively, to better care for the people they have the opportunity to serve. And ultimately, so we're tracking healthcare outcomes. People should be getting better because they have teams like us working with them. And so a
Yeah.
lot of that is based on assessing their outcomes too.
Okay. Cool. So you studied undergraduate at University of Kansas and got your bachelor's in occupational studies. Um, what kind of led you to want to go to KU and kind of lean towards that occupational studies degree?
Yeah, going to KU was pretty easy for me. I've lived in Kansas my whole life, and so it was right up the road from where I grew up in Topeka. Picking occupational studies, which is kind of like a precursor to the occupational therapy degree I got during my master's program. Um, you know, I'm sure like a lot of college students, I had no clue what I wanted to do when I got to KU. And so I took a pretty wide range of courses. And interestingly enough, I got pulled to occupational therapy based off of a random shadowing provider in someone's home. And it was one of those instances where I hadn't really planned on it. I think I had to do it for a class, and wasn't expecting a ton from it, but going there and seeing this person caring for another individual who really needed help, like really like changed my life. Like seeing someone care for another person, I think was kind of that first moment where I was like, yeah, this is definitely what I want to do, how I want to impact, or how I want to dedicate myself to others, and ultimately kind of selected that degree for me, which again was more or less a precursor to what came next.
Right. So then I guess with going next, you got that master's in occupational therapy also from KU. Um, Describe kind of the transition from the undergrad program into the graduate program for us.
Yeah, I would say the undergrad program for me was really just general. It provided like a wide lens of maybe some things I needed to know. I will say there was probably a lot of courses that I took that I never like reference again. I took organic chemistry. I could not tell you one thing about organic chemistry now as an adult, but
Right.
so the transition from my bachelor's degree to my master's program was specificity. So in the master's degree, I learned how to be an occupational therapist. I learned a lot about the physiology of a person, the anatomy of an individual, even really complex things like how do our brains work? And when you are injured, how do you rehabilitate someone after, injury? And so, that 2 year process after my bachelor's degree was really just kind of educating me on those foundational components that is necessary to be an occupational therapist, as well as providing clinical opportunities to kind of learn the hands-on skills that you have. And so, yeah, that was kind of the main difference was, specificity for what I would be doing, as a provider.
And how long was that program, and what were some of the classes you took at KU Med?
Yeah, so it was 2 years. So on top of the bachelor's degree, some of the courses that I took, I kind of mentioned there, like anatomy. I think I had to take like a basic, like functional course. So like around like how do you measure, someone's ability to walk. So it's around like functional measurement. There's a lot of framework around like neuroscience. So again, understanding how your nervous system works, and more importantly, like what do you do to help someone improve when it's injured. But on top of that too, we did have like a number of clinical rotations, and I think we had two. They're referred to as field works. We had two 3 month long field works as part of that curriculum. And actually, one of my supervisors, I think you've spoken to previously, Lori, who's now affiliated with KU Med again. But that's a really great opportunity because you get to learn directly from a provider out in the real world. You're treating real patients, you're getting feedback on the things that you're doing well, and more importantly, the things that you probably need to improve on before you're just kind of handed the reins as a provider, once you graduate.
Right. So then, while you were working on your master's, you kind of worked as a rehabilitation technician, and then moved into that occupational therapist role within St. Luke's Health Systems in the hospital. What's the difference between a rehab technician and then the occupational therapist?
Yeah, that's a really good question. When I was a rehabilitation technician, that was kind of my first real like working experience in just a broader therapeutic environment or something affiliated with like therapies. That role specifically is like implementing a plan a therapist makes. And so a lot of the times, like my day to day when I had that job was I would work on, patients doing exercises after they've had knee surgery. But I wasn't coming up with like the exercises they needed to do. I was given the
Right.
plan, I would implement the plan with the person. And kind of the main difference there is as a therapist, you're responsible for coming up with a plan. Like, how do I get this person better? How long do I anticipate it taking? And then sometimes you hand that off to either a technician or an assistant to kind of implement the plan that you set forth.
Okay. Okay. So then once you did get that master's program, then you were able to move on to that occupational therapist role
Yep.
within that same company. How did that kind of transition and did you get that experience, working as the technician to allow you to continue working for St. Luke's?
Yeah, I mean, I think from a relationship standpoint, it was really great for me to have coworkers that knew me. They knew I was in OT school, and so I could probably market myself for a potential role that happened to be opening around the same time I was graduating. But I will say, I think a benefit too of that experience as a rehabilitation tech was I got exposure to like a lot of different areas of working in a hospital before I was officially graduated. And so that kind of prepped me to think about, do I see myself working as an occupational therapist in an inpatient setting? Do I think maybe I want to work on an outpatient basis? And so it kind of gave me exposure to like a lot of these unique settings within a hospital on where I might, where I could have worked. And then, thankfully those aligned well with kind of what St. Luke South was needing once I graduated.
Okay. Yeah, that's pretty cool. And then so you kind of chose to get your PhD also in therapeutic science. And I believe at the same time you were a graduate teaching assistant at KU Med. Is that correct?
I was gonna say I had a lot going on at that point in my life. I think I had two kids at the time.
Yeah.
As part of my entry into the PhD program, I got offered a role as a graduate teaching and research assistant while still continuing to work as an occupational therapist at St. Luke's South, and all through the University of Kansas. So at some point, I should have, I think, a library named after me with all the tuition I've paid KU over these 3 degrees.
Right. That's pretty good. Describe what a graduate teaching assistant does and kind of your role helping the graduate students.
Yeah, a lot of my responsibility was a lot of like the hands-on learning.
Okay.
So like an example there, it's probably somewhat simple, but like how do you take blood pressure, like someone's blood pressure if you haven't done that? How do you move someone after they've had a spinal cord injury and they don't know how to move themselves? And so it's like really kind of teaching like the hands-on skills that a therapist needs to have, and just kind of provided more or less the students with like more someone like they could reach out to with questions
Okay.
and things like that.
That's pretty cool. So then your PhD program was 4 years. Is that correct?
I that is not correct. It was
Okay.
I think 6.5.
Got it.
I wish it was 4, but I got my money's worth. So no, it was a little bit longer than that.
Yeah.
But yeah.
Well, yeah. I mean, especially with working full time, being the graduate assistant, and then as well as taking your PhD program classes, that kind of makes sense as to the length of time for that. What is the difference, I guess, with a PhD versus an MD versus in therapy?
Yeah. So I would say like an MD is probably still more tailored around clinical care. Like they're actively caring for people. Whereas, and this is probably painting with a wide brush, but someone who's pursuing a PhD is more interested in the research side. Is they want to answer questions that maybe haven't been answered before. And for me specifically, like I noticed there was a lot of things that I was doing as an occupational therapist where I would come home and try to find evidence to support, some type of task or intervention I was doing, and I wasn't finding a lot. And so I wanted to kind of help contribute to that evidence base of either occupational therapy or just broadly, therapeutic sciences as a whole, which ultimately kind of pushed me down the road of doing research and knowing how to do it effectively.
Okay. So then that kind of drove you into working for Cerner as a data scientist. Then I'm guessing.
Yeah, yeah. As a data scientist, like at that time, like that term didn't exist. The profession itself did not exist, 10 or 15 years ago. And so, as part of that process, when I was completing my PhD, I took a ton of statistics courses, which is kind of necessary. Statistics is a thing, is more or less knowing how to answer problems with data. And when I think a lot about like what I do today and what I did at Cerner as a data scientist, that's exactly the framework that you apply is take data to answer problems or answer questions. But yeah, at that time, I was still in the process of completing my PhD when I talked my way into a job that I was probably very unqualified for, but just knew that that's what I wanted to do, and I'm very thankful that someone took a chance on me at the time to become a data scientist, and obviously picked up a significant amount of skills because of it.
Yeah. So then with Cerner, how did they incorporate a data scientist into what they do? Because they're mainly known for developing the programs for doctors and nurses to use. Like we had talked about the electronic health information system and getting that programs out to people. So how are you able to use their programs, I guess, with their data to help them?
So, the main, I guess one of the main things that I was really interested about joining Cerner was at the time, as part of my PhD program, we read this it's probably not really old, but it was a pretty old textbook called The Diffusion of Innovation. And it basically said it takes 10 to 20 years for an idea to diffuse to become standard practice. And like the more and more I thought about that as I was becoming a researcher, was like, I don't want to wait 10 to 20 years for a finding that I may come across to become like implemented into practice. And I thought Cerner had like this really unique opportunity within their medical records and their electronic tools to actually embed evidence directly in front of the eyes of a provider immediately. And so you're not necessarily requiring, a team of doctors to read an article that you published, or, some news, site to pick it up and it becomes viral and things change. They had this mechanism through their electronic health record to kind of present evidence-based decisions directly into, their day-to-day process. And so, that's kind of the route that my team took. Was, we had this platform, called an electronic health record, or EHR or EMR. And we would build, predictive models into that platform. So to kind of provide some insights into what a patient is at risk for, or to help, again, clinicians make better decisions without them needing to analyze millions of healthcare records or to read tons and tons of research articles. It was just kind of right in front of them.
So you're able to do that for 2 years before you started working at Wellsky, where you currently are employed. How did that switch kind of happen, and what did you do as a with Wellsky as a senior data scientist?
Yeah, so the switch kind of occurred. It's just kind of I don't know, a serendipitous opportunity. I was looking to just take on more responsibility as a data scientist. I'd learned a lot in that 2 year period at Cerner, and I was just presented an opportunity here. And I was the first data scientist hired at my company, so it was just me and myself. And so sometimes that's nice if you're ready to kind of roll your sleeves up and get to work. You kind of get to set the pace on what it is that you want to work on and how you work. So I kind of took that opportunity to join this company. But I would say more importantly, after like just analyzing a lot of data from Cerner, I realized like hospitals themselves, um, we're going to become full, as more people age. As baby boomers start to get into the age where they need more and more healthcare. um, all the hospitals aren't necessarily going to be able to care for people. And I think we started to see that a little bit with COVID. Because of COVID, some of these different care settings were just flooded with people. And the solution to that problem is delivering more care in the home. And we're almost like reverting back to like the way that doctors used to visit, people in their homes and things like that. But I saw a lot of opportunity, with that, given the aging population, and different reimbursement models and things like that. And that is typically kind of what my company Healthify, we tend, or not Healthify, sorry, Wellsky, we tend to prioritize, is how do we enable more care to take place in a person's home where they're more comfortable, where the infection risk is lower, cost is lower, and all that.
Yeah, that's pretty interesting. So you've been there since 2018, and you kind of moved up the ladder a little bit. Now you're the director of data science. I'm assuming that comes with a team of people that you're kind of in charge of and help manage.
It does, yeah. I have the wonderful opportunity of working with really brilliant people. The one thing I think I've learned to date over my career is you are able to build or work on a lot yourself, but the things that you're able to accomplish as part of a team will drastically exceed what you're capable of doing on your own. So yeah, that's something that I'm really grateful for in my current role, is having the opportunity to work with and manage a pretty brilliant team of data scientists and analysts.
Yeah, that's pretty cool opportunity there. And like you said, the team together is the greater sum of the team. Really stands out above just one person being able to do something by themselves. Um, so then with the Wellsky, what do you really love about your job and feel just rewarding for working for them?
Um, there's a lot. So I would say, for me, I think I'm somewhat unique in the sense that I do have a clinical background. Most people in my position, maybe they've worked in healthcare a while, but they haven't like cared for people. Like I've cared for people. And a lot of what I think about, daily is how I can help my former self or my colleagues as occupational therapists, or the care team I used to work for that included physical therapists and nurse and doctors. I think right now when I think a lot about healthcare, like those people are really burned out. They've worked really hard and a lot because of the COVID-19 pandemic. And the thing I think I'm most grateful for where I work at is we are encouraged, and you know it's a priority to make sure that we're building things to help those people. One, because they need it and their patients will benefit from it, but two, it's just having the context of being in that role before. Like I know how hard that job can be, and it's important, and I really do appreciate having the ability to make that maybe slightly easier on a day-to-day basis, for themselves and their patients.
Yeah. So then with Wellsky as a company, what are some of the cool things you guys are doing and looking into the future for healthcare and just getting people healthy with the different findings that you're able to get?
Yeah, I think some of the things that we're looking at right now, we're really starting to dig really deep on what's referred to as social determinants of health. And
Okay.
so those are elements like in your community, your neighborhoods that might impact health outcomes. So looking at things like your ability to drive to appointments, what is your environmental factors like pollution or noise pollution, all of these other things that maybe are traditionally outside the scope of traditional healthcare, which includes like vital signs and like your diet and all these other things, but really trying to create a more holistic view of a person, which is likely heavily related to your healthcare needs over time. So digging into stuff like that is really something we're beginning to, I think, dig a little bit deeper on. But I think more specifically, I'm really excited to start, having, beginning to like use things like your Apple Watch, and start to, one, not only have some information about you as a person as it pertains to activity and sleep and all these other great things, but using that as a way of like communicating with your healthcare provider. Like, how can we figure out ways to, knock down potential barriers in your ability to access healthcare, or even like knowing as a provider that you need to reach out to Drew because he fell yesterday. I knew he fell because his Apple Watch told me he fell. I should follow up with him and make sure he's okay.
Yeah.
And so really thinking about like that more holistically, I think is something we're focused on pretty deeply right now, and will
Nice.
continue to in the near future.
That's pretty cool. So your company has a lot to offer. You offer home and post acute, or you're able to provide your services for home and post acute providers, hospitals and health systems, community based organizations, states programs, commercially and privately, and then additionally for patients and families. What are some of the benefits? I guess, I mean, that's a wide range and a big population that is able to use the information that you're able to provide. Um, how do those types of teams or people able to find or take their information uh, through a program and know, hey, this popped up, I may need to go contact my provider?
I that's something I think we're constantly challenged with, and I would argue we as a company are probably uniquely positioned to solve for it because we do cover so many of those different areas. And when you think about like traditional healthcare, where your hospital is here locally in Kansas City, we'll say it's KU, KU's hospital because again I paid so much tuition, I got to give them a shout out. But like those traditionally haven't always been connected with like your primary care office, or they haven't been connected to, your physical therapy outpatient clinic that you go to after knee surgery. And so the one thing I think that we're uniquely positioned is like we have the ability of kind of connecting all those different things together to follow you as a person. And traditionally in healthcare, I think that's something we've kind of lost sight of is it's about the people who need help, right? It's not necessarily the setting in which they get the care. And I will say, like, that's something I'm really excited about, over the next 5 to 10 years is, us and other companies in the healthcare space knocking down the walls of what used to be relatively siloed care, meaning care takes place in the hospital. I think it transferred to, my home, but then I have outpatient visits, but that information about me doesn't follow me, where care will be more centered around you as a person and not necessarily where the care takes place.
Yeah, that makes a lot of sense. Um, so then, what is some professional development as a data scientist that you're able to do to help you in your job and your career?
So yeah, I was going to say the wonderful thing I think about data science, that I have been like an immense beneficiary of is just the amount of information that is freely and openly available. I again, like I've been a data scientist now for like 7 or 8 years. I didn't have a college degree in data science. I've never have taken a computer programming class or a data analysis class, but I do those things on a daily basis. And it is based off of like the free and available resources that are available online. And so I would say, for someone who's interested in getting, some exposure to data science and trying to like build those skills, it's just like, just look online. Like what are some beginner skill sets to build as a data scientist? I've used like Udemy and Coursera. YouTube's actually a really great reference if you kind of know where specifically to look. But I would say even more importantly, and as it pertains to being a data scientist in healthcare, is understanding how healthcare works, just very generally. What does a clinician, who works in a hospital, what are they trying to solve for, the problems that they face that may be a little bit different than someone who, cares for someone in the home or cares for someone in a skilled nursing facility and things like that. So getting context that allows you to then frame your data science skills towards a problem, I think is really, really important too.
Okay. So what are misconceptions, I guess, that people may have about data scientists?
I would say the biggest misconception that I get is that we are immensely like technical, meaning all we do is code, and I don't know, develop computer algorithms and things like that. And while I do think there are, again, on my team, there are people who do that and are incredibly skilled at doing that. That's just like a subset of kind of the role. Like again, like I view our role as someone who can help answer questions with data. Sometimes that does involve really complex analyses and working with a computer to do the analysis itself. Sometimes though it's just thinking about a problem. It's reading and researching about an industry and thinking about how we might be able to impact it or solve it. So I would say and I do see this a lot now where people are too afraid to get into this field because they assume it's going to require, a PhD, and it does not. Well, I do have one. My PhD is not in data science. Like
Right.
it was kind of as part of that process of becoming one. But today, there are people who are data scientists that don't have bachelor's degrees on my team, and they are phenomenal at what they do. And so just don't be discouraged if you have a sense of thinking like I need to have these really deep technical foundational skills that shouldn't deter you from really getting into this field and beginning to figure some of that stuff out.
Um, so I guess talking about, not having to have a degree or anything like that, and, not deterring yourself from having to specialize as a PhD or anything like that. If you could go back and change something during your path to where you are now, is there anything you would have done different or maybe wish you would have done along the way?
I've actually thought about this a lot. I've been in. I'm trying to think how long I was in college for, and it was 10 plus years. But I'm the type of person where I'm like, you get where you're going, um, and part of the process is the journey that you take. And so because of that, like I really don't think I would change much. Maybe I change a little bit of the courses I took as a bachelor, as part of my bachelor's degree. If I would have known I would have became a data scientist, maybe I would have taken some slightly different courses. But I would say generally speaking, I'm really thankful that I went the clinical route first. I became an occupational therapist. I got really good experiences, built really great relationships as part of that, and ultimately I became a data scientist to help those people, right? And without that clinical experience, I do question whether I would be as effective as a data scientist today, having not had some of those experiences. So I would say again, like I mentioned, like I don't think the PhD is necessary for some of the work that I do, but I also think at the same time it has helped me in a lot of different ways that helps me frame problems, or even internally working in a business. As a researcher, I had to submit grants for to fund my research. I have to kind of do the same things internally in a business to fund our team. So a lot of those skills translate really well. But man, the amount of tuition I've paid, yeah, I do regret some of that. But
Yeah. So then professionally, maybe coming up with something that is a marker or something like that, or award. Do you have anything that you're really proud of achieving?
Now I'm really proud of like my team, and like the problems and the relationships that we build with our clinical partners and providers. I think that's what I mean, that's our mission really. Like we're here at this company, Wellsky, and really dedicating ourselves to this type of work because we want to make sure that healthcare providers are making better decisions every day, because ultimately patients are the ones that benefit from those decisions. And so, we're not necessarily out for awards or things like that. It's understanding that, the things that we build, when in the hands of really skilled providers, are actually leading to better health outcomes.
That's cool. Yeah, I think that, like you said, as being the first data scientist hired there, and then now having a team to work with. I mean, that's something pretty important to have
Yeah.
and grow the field. Um, where do you kind of see yourself professionally, and maybe 5 to 10 years down the road?
I That's a really great question. I If you could ask me this, 7 different days, over the course of the next week, and I'd probably have a different answer. But right now, I want to continue doing the work that I'm doing with the team that we have. I am interested in growing our team, because again, as I mentioned, I think we can accomplish more as a group than we can as separate individuals, and I think there's a lot of empowerment behind that. So I think growing the team that we have here, but at some point, in the next, decade, I'm probably going to be pretty interested in seeing if I can start my own company, just given the experiences that I've had to date, both here and elsewhere. That there's a little bit of piece of me that wants to maybe consider some of that stuff and all the risks and stresses that go along with it too.
Yeah, there is quite a bit of risk and stress that goes with that, especially with the family and that kind of stuff. So let's look at some different age groups of like high school kids through college and your first job. So talk to yourself in each of these four scenarios and what advice you would give to the student or individual now in these different moments of time. What advice would you have for a high school student that is driven by numbers, driven by wanting to help, and kind of thinking, after listening to this, data science might be something that I'm interested in. What advice would you have for that high school kid as to something they could do to see if it was the right fit or find out more information about?
Yeah, I'd say start playing around with numbers. Like looking back, I was really into baseball
Yeah.
as a player in high school specifically, and like it taught me a lot about statistics and data science. Like that sport is really kind of based around a lot of foundational principles of statistics. And so whether it's baseball, whether it's a sport, whether it's like esports, like just get used to like playing around with data and answering questions with data. um, and I would argue too, just push yourself to have diverse experiences. Don't feel like you need to have everything figured out as an 18-year-old, because I don't think many do. So continue to figure out what you want to do, and then I think that's okay if you don't have any idea what that is.
So then, somebody that's in college, maybe they're studying data science or occupational therapy. They're in their undergraduate programs, and they're kind of honing in on, they took that one class that they really liked, and they're kind of putting the pieces together. What advice would you have for them?
Yeah, I think at that point, and this is something I saw a lot of value from when I was that age and maybe slightly older, is whether it's volunteering, whether it's finding a job, just get yourself in the doors of a healthcare entity. Whether that's volunteering at a hospital, whether that's working as like a rehabilitation technician in an outpatient clinic, just getting exposure to one, different roles within healthcare. And if you're interested in becoming a physical therapist, for example, like try to become closer to the PTs that you interact with.
Okay.
See if you can shadow them and really put yourself in their position. For me, that was, I think, something I didn't do early on enough. And had I would have done that, I think I would have. Maybe that's one change I'd look back and maybe
Right.
suggest I make is doing a little bit more of that shadowing, because that does really allow you to put yourself into that role of that person and ask them like, hey, like, do you love your job? Like, what are some things you like? What are some things that you hate, or wish were different? And that just kind of allows you, I think, to better envision where you're going to be going, and more specifically, what types of things you as a person maybe need to work on too.
Okay. And then now let's look at somebody that's a little closer to graduating. Maybe that's 3 to 6 months out from their undergraduate or their master's program, getting ready to find that first job. What advice would you have for that person?
I'm someone who I don't think I realized the importance of just networking until relatively late in that process. So
Yep.
thankfully, I had a job basically lined up before I graduated. But I would say beginning to network either through volunteerism, whether it's through shadowing providers, that stuff really does matter. And it is, I think in today's world, when you're applying for jobs, the easiest way to land your resume on top of the stack is if you know someone, and they can vouch for you. So I would say really try to network as much as possible, even if it's, again, just shadowing. If you want to work in an outpatient clinic, go shadow in some outpatient clinics, because now they can put your name to a face when you come back in and interview for a position in the near future.
That goes along with one of the quotes, kind of, that one of my other guest speakers had was, "Know what your friends' parents do." And
Yeah.
I thought that was pretty interesting. I was like, I never really thought about that. But if you know what they do and you think that that's something that's interesting to you, that's a quick entrance into the field of, and just finding out more about it.
Yeah, I was gonna say, I don't know if that's even like personal brand building, but too, make sure those around you know what you're doing, what your goals are, what you're looking for, because I think at the same point, like, I think most people want to help each other, and sometimes I think the reason we don't is just because we don't know what you're after. So don't be afraid to ask for help, making it known what you're shooting for, and that's part of that process too.
So then let's look at somebody that's been employed for 3 to 6 months in their first job as a data scientist. What advice would you have for them as far as what to look for and ways to continue growing?
Yeah, so like 3 to 6 months in, I would say your most important, I guess, portion of your job is making sure that the value that you bring is clearly known to those around you. So whether that's, here at Wellsky, like our clients, or our clinical partners, like they need to know that the things that we're building work. So being able to put into context, for the things that we build, how many hospitalizations have we theoretically impacted? Are your patients getting better faster? Things like that. But I think, a lot of times, again, this gets at the technical component of the role sometimes, but we have this tendency of just getting super complex into what we build and what we're trying to solve for, when in the end some of that stuff doesn't matter. When you're a healthcare data scientist and you're building, tools and applications to get patients better, the outcome that matters is, are people getting better, right? So being able to tangibly, assess that and really show the value that you're bringing, I think is really really important. I don't think just for, someone who's 3 or 6 months in. I'm 8 years in, and that is something I'm still continually doing. And I've seen a lot of benefit from prioritizing that.
Okay. And I know you had mentioned earlier about a book that you liked in your undergraduate program, but do you have any recommendations? Maybe a book, a movie. Moneyball comes into mind of thinking
Yeah,
about
yeah.
data science and sports specific data science. But maybe something like that a high school kid or a college kid that thinks that might be something cool for them to
Yeah.
check out.
So yeah, Moneyball is a great one, if you're from a sports background. But I would say, like, if you're interested in data science specifically for healthcare, a really great book that was written in the last couple of years is called Deep Medicine. And it's around how we apply machine learning and artificial intelligence to solving healthcare problems. That's a really good one. I'd say, on a personal note, one book that I've read probably 4 or 5 different times over the last 5 years has been Mindset by Carol Dweck. And it's really around just, how important your mindset is when you're trying to accomplish hard things, and how powerful that can be as an individual. So I'd recommend that too, just on a personal level. And as you seek to become a data scientist, or, hopefully something specifically in healthcare, but that was a good one for me.
Yeah, I like that a lot. A couple more questions for you, and then we'll be done. If you like blank, then being a data scientist is the right career path for you.
I would say, if you like being a problem solver, creatively, then
Right.
data science is for you. This is
Then let's
not a profession where it's like, you have a list of things and you just check boxes off that list. You have to be willing, to be creative. You have to understand, what the problem is. And then more specifically, again, just, I mean, that is the main drive of everyone that I know that is a data scientist, is that is who they are, like, to the core of them as a person, is a problem solver.
flip that around. If you dislike blank, then being a data scientist is not for you.
I would say, if you dislike, sometimes ambiguity.
Okay.
There is sometimes some, again, like when you're seeking to solve problems specifically with data, there are sometimes where, the path to doing that is not always crystal clear. And so you do have to kind of explore and feel around. And so if you're expecting a tight path to get from point A to point B, that is not going to likely happen here. Which again is probably where that creativity kind of becomes, increasingly important.
Yeah. Do you have a mantra or quote that you kind of live your either your life by, or something that helps you at work?
Um, oof. It's better to, rust out than wear out.
Okay.
And I don't know who said that.
Can you explain how that relates a little bit?
Yeah, I mean, this is not just work related, it's probably just life, but like, I want to wear myself out by being active, by taking, action and committing myself to, things that I value, rather than to, I don't know, relax and take an easy path. I think there's a lot about my history that,
Yeah.
would indicate I'm pretty resilient, and at some point I may not have always made the smartest choice, but, in the end, I do think, I don't know. I think it's really important to take risks on yourself, and sometimes that's a long window. again, finishing a PhD in almost 7 years is not a quick process. So again, I'd rather rust myself out than just let it happen naturally, or vice versa.
If someone's interested in learning more about Wellsky or getting in contact with you, do you have any social media channels or websites that you could share with us?
I do. So I'm on LinkedIn, just Mark Burghart. I'd be happy to reach out to anyone there. I do have a Twitter handle, which I have not probably accessed in years, and I don't know how long Twitter is going to be around. So maybe that's not the best method to reach out to me. But I also do have a personal website that is currently under construction, called secondmark.com. I'm Mark Jr., so I'm the second Mark in my family, and that is where my personal web page lives. So either LinkedIn or there is a good spot to get a hold of me.
Okay. And then wellsky.com as well.
Yep, that'd be a good spot.
Perfect. Well, thank you so much for spending this hour with us and talking about what you do. It's been pretty interesting to hear about it, and look forward to finding some new stuff in the healthcare systems out there.
Yeah, no, I really appreciate it. And I was going to say, anyone that, I really appreciate, this, you taking time to actually showcase jobs in healthcare. I think right now there's immense need, but I also think there's immense opportunity for people, as they get out of high school and college, who are looking for stable and growing jobs. I really can't think of another area that is as important and impactful as healthcare. So whether it's data science, whether it's we talked a little bit about occupational therapy, other things, it is a wonderful and obviously very fulfilling place to be at as it pertains to your career. And yeah, I'd be happy to talk with anyone who wants to follow up or whatnot. But I do really, really appreciate you kind of talking through some of these different options.
If you've made it this far into the episode, I want to thank you again for watching. Please subscribe, share, and comment below with any questions or comments you may have. If you're interested in more information about other professions within healthcare careers, please visit healthsciencecoach.com and talk to your school counselor or academic advisor. As always, stay happy, healthy, and live life with passion.